Hi, I'm Loretta Bush, President and CEO for Authority Health. And it's my pleasure to be here with my friend and colleague, Rosalind Andrews Worthy. She is the CEO for Gospel Against AIDS. And guess what? Because we have both been vaccinated with the safe and effective COVID-19 vaccine, we're able to be back here face to face on the sofa talking without having to be on Zoom today. Welcome, Rosalind.
Thank you. It is a pleasure to see you.
My pleasure as well.
Face to face.
So Rosalind and I go back a long way. And Rosalind, what I'd like you to talk about first, just tell our listeners a little bit about the Gospel Against AIDS and what it has been doing in years past.
Okay. Well, I was just thinking about this, and it's been around, we have been around for 25 years. Started in Detroit with a woman who was living with HIV and AIDS, a senior, who told me, you need to do this. And I'm going to do what? Provide HIV medications or HIV education to houses of worship. And I thought, how is this going to happen? This is definitely not, I'm not a public health expert. She said, well, just follow me. Let me have the opportunity to speak before a congregation. And we did. From that, it has taken on a life of its own. So we were 1 and 2. We moved to being 3 and 4. We brought on Sean Parker, who provided the AIDS 101 education. And from that point, we are now, let's see, oh my goodness, in 3 continents, 3 countries, and reaching millions of people, either face-to-face or via virtual technology.
3 continents
Yes.
and multiple countries.
Yes.
And you know, it's amazing because when we first met, HIV and AIDS was the global pandemic of the day. And realizing even then that reaching people in faith communities was going to be the way to go.
Absolutely. Well, you know, I didn't see it. I was just doing what I was told.
Yeah.
But you had the vision, because you were the encouragement. I remember coming to you perhaps with the idea written on a napkin.
Written on a napkin. Well, you know, back then I was working for someone who was the funder. So I'm glad that you brought that ideal to me and that I was able to help you to bring it into reality, because you've really helped a lot of people in a lot of ways.
Well, again, you have the heart. You have always had the heart for community, the heart for the marginalized, the heart for the outliers, and you have the vision. And under your leadership with the health department at the city level and the state level, Michigan was on the map as far as creating innovative programs for persons living with HIV and AIDS. The things that you saw and the vision that you had to uplift the community truly work, and talking about reaching millions. So I just want to take this moment to thank you on behalf of those who cannot thank you for the lives that you have saved and touched.
I appreciate that. I appreciate that. It was definitely teamwork. We worked together for it, that's for sure. And now, you know, now we have, we've been faced with a new challenge. In 2021, here came something called COVID-19, coronavirus. Coronavirus. Now talk to me about that, because you're still doing the work with the population of people who are now not only surviving with HIV, but they're thriving with HIV. And then comes coronavirus. What was it like in 2021 while you're working with this still vulnerable population, even though they're doing, you know, they're living longer, living healthy, but then now we're faced with coronavirus. What was that like last year?
Oh my goodness. Well, first, HIV is my passion.
Yes, it is.
And COVID-19 has become my second passion.
Okay.
Having said that, you need to direct me if I start veering off and if I start talking more than what the time allots, because this means so much to me.
I'll bring you back.
Bring me back.
All right.
Okay. What is astounding to me is the similarities of HIV and COVID-19. Had we not had HIV, we would not have the base that we've had and used to create the vaccines and the mindset and the strategies to combat COVID-19. Yeah. It's just been amazing. So last year I received a call from actually some of our clients who said, I'm fearful. Are we going to die? What is this?
Yeah.
Pulled together Dr. Theodore Jones, who is our board chair.
Who's amazing.
Yes. Beaumont Hospital, and Dr. Peter Gulick, who is Michigan State University, but also a member of the Infectious Disease Society of America. And said, work with me. We have to have a telemed session that informs people, gives them the opportunity to ask questions. That's key. And they can see survivors from this and know that there is hope. Started it, went for 1 month, and I must thank the Michigan Department of Health and Human Services because they provided the virtual platform. I didn't have a clue.
Okay.
So a year later, we have gone to 6 states, 3 cities, and through National Public Radio have been able to reach at least 1 million listeners through these webinars. Yeah. One of the things that I think started in the onset for this virus, and which has made it so lethal for us, particularly in the United States, is the racialization and the politicalization of the coronavirus.
Of course.
That has never left. So when you have that at base, then you have lack of access to information. The communication ideas, the media, what they're doing is fantastic. We look at the Walgreens commercials, the visuals that we see of African Americans, of people of color, of religious leaders getting vaccinated. It's great. But people want answers to questions. They have questions. Also access. You know, we know the TCF Center, is it closed or closing to? So you still have a population of folks who couldn't get to the TCF Center.
Absolutely. Now see, I have to ask you a question because I really do agree with you that many of the lessons that we learned with HIV and AIDS, that we're using them with coronavirus.
Absolutely.
And don't you think that like the media images and communication strategies that the pivot with COVID, that they were that communication was better because of what we learned with HIV, that people needed to hear them, see themselves,
Absolutely.
that they needed to hear it from folks that they trusted,
That's right.
that they needed messages that were
Yes.
relevant to them,
yes.
that all of those things were things that we learned with HIV.
Absolutely.
And that I'm not sure that it necessarily was at the beginning, but that the pivot happened quicker.
Yes.
Because of what we learned in the days of HIV and AIDS.
Absolutely. And even down to the science and medical part of it.
Yes.
Absolutely. That cannot be more underlined because it's absolutely correct.
Yeah.
The medical part of it, they're now looking at T cells for the longevity of the vaccine. So again, we go back to the foundation of HIV.
Absolutely, and even with that, you know, the treatments, finding the treatments really quick because people were dying, and the whole issues around RNA and all of that, moving quickly to find answers to what was the pandemic of the day, and learned a lot from that.
And Dr. Fauci, who was he spearheaded so many programs for HIV and research and medication. He was the natural to take the forefront for coronavirus and COVID-19.
Agree with you 100%. Well, now we have a safe and effective vaccine.
You have 2. Yes.
Yeah, safe and effective, three. Safe and effective vaccines. So, what's happening in the HIV community? Are people taking it? Are people being hesitant to take it? And I know this is going to be a generalization. I know you can't speak for everyone in the community, but what are you seeing? What are you hearing?
I'm hearing that people are taking the vaccine.
Great.
Without a doubt.
Good.
What I had heard prior to that were escalating numbers of suicides. The isolation threw back to memories of isolation from HIV. Not being able to get to their physicians, not being able to attend support group meetings. Because no one had the knowledge at that time how to use Zoom. So that was just heartbreaking because again, I started getting these phone calls. Is this something, how can I combat this? There's nothing out there. No one is addressing our needs in our community. While persons living with HIV and AIDS were a part of the clinical trials, they weren't a large part. And what people didn't understand in those clinical trials were we didn't know, the community didn't know how they would react, how they interface with medications, their antiretroviral treatments. Not at all any hesitation for taking the vaccine. Now we get to a point of long haulers. And I don't want to jump the gun because that's another subject I could talk about a very long time. But now we have people who are HIV positive,
Right.
Survived COVID-19,
Yes.
and are long haulers. But because of their immune systems being so compromised, even with the antiretrovirus treatments, they're still experiencing extreme long hauler symptoms.
Yeah.
I know of some people who've had to have lung transplants. And so you're fighting it on a number of levels.
There's a lot going on.
There's a
Rosalind.
lot going on.
There really
But
is.
I am hopeful. I am really hopeful and optimistic and thrilled about the work that we're doing together.
Absolutely, and we're going to talk about that.
Yeah.
I want folks to know I'm Loretta Bush, President and CEO for Authority Health, and I'm speaking with Rosalind Andrews-Worthy, who is the CEO of Gospel Against AIDS. Rosalind, tell our listeners how they can reach you if they want to know more about the work you're doing.
Okay. Our website is www.gospelaa.org. That's www.gospelaa.org. I can be reached via email at gospelagainstaids, all one word, @gmail.com.
Now, I do want to start to transition and talk about the work that Gospel Against AIDS and Authority Health is doing together, because I am very, very excited about the vaccination efforts that we are doing together. And you mentioned some of the mass vaccination efforts that have been happening, and those are all so important. But now we are getting down to the nitty gritty where we need to go where the people are, the hard to reach people, the people who may want it, but they're not going to make it to some of the mass vaccination sites or where they need to be reached, maybe at 6 o'clock in the morning or whatever. So we have partnered with Gospel Against AIDS, and when I say we, I mean Authority Health, where we have done a vaccination session, and we'll be doing more with like methadone treatment centers. And what I came to understand is that some of these hard to reach population is because they need to be accessed at 6 o'clock in the morning or 7 o'clock in the morning, and they need to be reached in areas and in venues where you find them. So talk a little bit about that and the church outreach as well.
Again, I am thrilled at the work of the governor and the mayor. Of how they've conducted themselves during this. I just read yesterday that the city of Detroit is now going to be going door to door with persons with disabilities to provide vaccinations.
Isn't that excellent?
That is. So we are another weapon in the arsenal.
That's right.
Under the Gospel Against AIDS umbrella, we have services and provide HIV testing in these different sites, methadone treatment centers, different churches. And all of the areas that we go into are in high HIV prevalent communities. So the idea, again, some of the frustrations with some of these entities was that they contacted an entity for vaccination and they gave them a limit. You have to have at least 200 people or else we can't come and provide vaccines. So, you know, again, I hope we learn something from this, and I'm going to steer away very quickly, is that what impacts one person in one area, in one part of the world, will eventually impact, infect, and affect us all. So we have to be concerned about everyone. The fact that Authority Health is willing to go places where we go. We have churches that have maybe 50 members or 1,000 or 2,000 is wonderful, and you haven't put constraints on that. The churches have stepped up to the plate as far as being vaccine sites for weekends. So we're going to fill in the gaps. We're going
That's the key.
Yes.
And I think that's why Authority Health and the Gospel Against AIDS, that we were able to partner so well together, that you need those people who are willing to fill in the gaps, and for us to go and reach those 50, 60 people, because these are folks who also need access to the safe and effective COVID-19 vaccines that are available. Yeah.
And they also need the information. One of the things that we, again, providing these telemed sessions virtually, every organization, every entity that has kept these or invited us to provide these sessions, they went from maybe 10 to 15% of people who might get vaccinated to now 30 and 80%.
Well, see, that's the other key, Rosalind. You and your organization have been sharing wisdom for decades now. And you, Dr. Jones, Dr. Gulick, trusted sources, the trusted messenger. So it's not just the messenger, it's not just the message, it's also the messenger, right?
Thank you.
And so we really appreciate the fact that you and your volunteers and the doctors who you have had working with you have always been right where you need to be, doing exactly what you need to do, and really sharing wisdom, providing education, providing awareness, because people sometimes need to be moved along, right?
Yes, they do.
You know, and we don't just need to say, oh, well, people just ought to do what we believe is best for them. People need to be moved along. We need to meet people where they are and help them to
nurture them along the way.
Nurture them along the way. And certainly that's what you and the Gospel Against AIDS have been doing. If you had just one thing to share with the listeners today, what would that one thing be?
I'm not going to say go and get vaccinated, because everyone says that. But yes, get vaccinated.
Get vaccinated.
It's nothing to be fearful of. That's how we rid ourselves of this virus.
Well, I love that. And if I have just one thing to say, which I say often, and that is knowledge is power. And I just want to thank Rosalind Andrews-Worthy, who has provided additional knowledge. She's been providing that for decades now. I wish you well. Be safe.